The human hand is made up of the wrist, palm, and fingers, and consists of 27 bones, 27 joints, 34 muscles, over 100 ligaments and tendons, and many blood vessels and nerves. The hands enable us to perform many of our daily activities, such as driving, writing, and cooking. It is important to understand the normal anatomy of the hand in order to learn more about diseases and conditions that can affect our hands.
Hi, I'm Dr. Tacata, a hand surgeon at Manila Doctors Hospital. So what does a hand specialist do? The hand specialist takes care of hand problems surgically and non-surgically. This means he or she is consulted for injuries and for inflammatory problems like carpal tunnel, trigger finger, Dicker veins, and many other problems involving the hand and wrist. What is hand surgery? Let's talk about the scope of work when we talk about hand surgery. This involves 5 tissues of the hand, meaning the skin, bone, nerves, tendon, and blood vessels. So, which brings us to the training required to be able to deal with these 5 tissues. In the Philippines, training in orthopedics includes and prepares the hand surgeon for treatment or dealing with problems of the 5 tissues of the hand. There are other specialties which can lead you or bring you to the practice of hand surgery. General surgery and plastic surgery are 2 of them. So let's talk about hand injuries. Hand injuries can take place in the household setting, during sports activity, and in the industrial setting. Good results after injuries will be determined if diagnosis and treatment are done at the time of injury. This has to be emphasized because many times complications come from misdiagnosis or simply deferring seeing the specialist for 1-2 days. Example of that is tendon injury. When you have a tendon injury in the hand, it is best that the tendon repair is done within a few days of the injury. Complications arise as you go weeks to several weeks after the injury. In any given day in the clinic, I would see common hand problems which are trigger finger, Dicker veins, and carpal tunnel, which initially are dealt with usually with injection for trigger fingers and Dicker veins. For carpal tunnel, depending on the age of the problem, how long it has been bothering the patient, if the patient can be treated conservatively, there's a program to deal with the problem of the nerve. And this requires discussion with the patient, including causes and possible factors which contribute to the carpal tunnel syndrome. There is not one factor which can be addressed and ensure that the problem can be addressed in carpal tunnel. It is actually the problem of carpal tunnel is not as simple or straightforward that one management program will ensure that the problem can be addressed. But in general, when conservative measures fail, surgery for trigger finger, Dicker veins, carpal tunnel is an option. So, what do I usually see in the clinic? Okay, in any given day, I would usually see trigger fingers, Dicker veins, and carpal tunnel syndrome. These three are what I call bread and butter. Maybe because I have concentrated on work in the hand, that's why these are what I see all the time. Trigger fingers involve problems with the tendon and really bothersome that the patient's use in the house or at work is affected. So necessarily they would consult for immediate treatment, for immediate relief, and that usually will involve steroid injection, which is tried for 2-3 times, but if it fails, surgery is advised. The same with Dicker veins, which is inflammation of the tendon in the wrist area. A trial of steroid injection is done, and if it fails once or 2 times, surgical option is brought forward. Now, carpal tunnel is a totally different problem. Carpal tunnel involves the nerve in the hand, a major nerve in the hand. It also presents in different ways, but bothers the patient to a degree that it affects work, it affects use in the house. It's usually, by the way, for trigger fingers, carpal tunnel, and Dicker veins and carpal tunnel, the age range usually is 40 to 60 years old. The patient presents with patients can present with bothersome numbness, pins and needles, usually wakes them up at night. It can stretch from 1 to 2 weeks to 1 to 2 months to 1 to 2 years, for as long as 10 years. The presentation varies a lot from patient to patient. There is not one exactly the same presentation in any 2 patients. For this same reason, the background per patient is different from patient to patient. In problems that I talked about, Dicker veins, trigger finger, carpal tunnel, it is very important that the anatomy and what is taking place exactly is told the patient, including pictures. I have pictures which highlight where the problem is taking place, what's going on, and if usually I would draw a molecular level, short of microscopic level. I try as much to picture to the patient what's going on so that he understands when I talk about what surgery can do for the problem. So it might be easy to diagnose from my end, but a lot of time I spend on explaining how surgery can relieve the pain and the complaint of the patient, especially flexor tendons in the palmar side can be deceiving. You might have a 2 or 3 millimeter puncture wound from a knife or from a pointed object and can be frequently missed. A less than 1 centimeter cut can be passed off as something which is self-healing, but no assessment was done to check for nerve, to check for numbness of the sides of the fingers. So what is the golden period so that a diagnosis of a tendon or a nerve injury has to be made? Okay, we are talking about a 2-week window. As you go outside and longer from the 2-week window, the more complications there will be if treatment is not done. Tendon injury, tendon reconstruction, because the patient was seen after 4 months, involves a lot of time, resources for the patient, time of work and expenses incurred compared to if it was done properly at the time of injury. It is the same with nerve injury. Nerve injuries, the complications of which, depending on the level, can be life-changing for the patient. So the take-home message is never consider the size, the smallness of the wound in the hand as something benign or something of no significance. It is best that evaluation is done by the specialist. There is no such thing as a simple hand injury. When you have something that looks simple or small, insignificant, it is best that a hand specialist be consulted and an assessment be done if no deep structure like nerve and tendon injury was incurred.